Yes?
Palpate the sulcus of sciatic nerve.
Okay, this is the main circus because this is separating the internal and external hamstring. So then,
So the lateral one will be the biceps femoris.
Exactly.
Short head will be distally. And the semimembranosus is internal.
so if I'm here, which is the first?
Semimembranosus.
Okay, semitendinosus, and then there is a slight circus, semimembranosus. So if I go a bit farther in, there is here a big circus. So let me check. I'm going to put this. Don't worry. So I'm going to palpate another circus. So here I'm falling in a circus, and then I will have
The gracilis.
gracilis here. So if I have gracilis here in this circus and other circus here, you will see that there is like a small area where adductor magnus can be needled. But if you follow this, you will see that this closes. Okay, so semimembranosus is going like this, gracilis like this. Okay, so this is like a triangle. Okay, so here, if we just insert the needle, we have adductor magnus. Okay, but well, we don't mind because if we want to do it here or here, we just go through semimembranosus, semitendinosus, and we explore. Okay, but we have to think in our mind that we will have to be moving the needle 2, 3, 4, 5 centimeters. Okay, this is the idea. Another option sometimes is to go to this internal part, because this is the way that you can needle a very deep part of the adductor magnus. Instead of going very deep from here, like in the foot, if you go medial, you are being very deep, because if you have the femur, all the muscle belly, instead of doing from here to the femur, you can place the needle like a bit posterior to the femur, but to cover all this part. So sometimes this approach is helping you to treat a lot of deep trigger points. Okay? Well, so we are going to check if we see some tight area. Well, here I think there is a possible trigger point. What do you think of this?
Yes.
So perhaps we can try here. We are going to flatten the tissue as much as possible, okay, and then we can insert it here. You have to also consider the approach. The needle orientation, if we do like this, we are not going to cover the adductor magnus. So remember, my palpation is going to lead the direction, okay? So if adductor magnus is here, perhaps the best direction would be something like this, okay? Remember, here, this is the correct direction. So if I'm moving, this is leading my insertion, okay? Well, so we are going to have a look. This is usually giving very, very powerful twitches, because this is a very big muscle, very powerful, okay? Well, this muscle, we haven't spoken a lot about this, but this muscle is also going to be related with adductor pain, groin pain, and sometimes this is giving a lot of pelvic pain, and also very related to the gluteus sometimes. So typical people who is studying a long time for years, sitting 12 or 14 hours, they are preparing in Spain. This is typical to prepare to be a, how you say, a judge, no? Or an important in the law department, okay? So they are public, but they have to study for 4, 5, 7 years. And if they spend a lot of time sitting, sometimes they develop some problems here in the gluteus, quadratus femoris. All these areas tend to have pain, and sometimes this is also a bit related, okay? Okay, so here, for example, we can use this 50, but he has a big muscle, so we can use the purple, for example. Okay, not the black. Huh? Yeah. So we are going to palpate semimembranosus. I fall to a space and here. So I'm going to leave just the space. I put it here, more or less the orientation is this, although I can be changing the direction, okay? Well, as always, the first insertion is very gentle, so I can stop, and I'm going to be sure I have provoked a local twitch, so this is fine. Okay, so now I'm going to look for twitches. I found some of them very superficial here, okay? But they are very powerful, you see. One more. You like? Okay. Yeah, but it's very frequent to see big twitches, okay? Because this is a very long and thick muscle. Okay. Well, so we are going to practice adductor longus